I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's? The current fee-for-service healthcare system rations out care based on the patient's ability to pay. I believe this is unethical. It is criminal. 95% of the country is still functioning on this fee-for-service model. I believe everyone should be treated the same. Everyone should have access to primary care regardless of their ability to pay. Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to primary care, and ChenMed needs physicians to take care of them. Today's topic is Hyperdrive to payment reform. My co-host and moderator of the chat, Dr. Dan McCarter. Dr. Dan, how are you doing this evening?
Good. How are you, Faisel? It's good to see we already have questions lining up for you tonight, so it should be a lively conversation.
Oh, I am so thrilled to have tonight's friend come on. She's more of a pal, I think. I feel like when I speak with Ann Greiner, it's a mix between talking about things that make us want to make this world a better place, and also just a dear friend and pal where I can talk about real life situations as well. So I'm just so pleased to have Ann Greiner. Welcome, Ann, tonight.
I'm so happy to be here.
And I loved reading your paper a couple months ago about the switching from evolution to revolution with primary care payment reform. And I'd love to give a bit of a history, especially to any of the medical students or residents who are listening, about where we've come from with the fee-for-service system in the first place.
Well, thanks for that question. And, most folks who are practicing medicine today are paid on a volume-based system that's based on RVUs. So the more you do, the more you're paid. And it's been a system that, was really supposed to equalize payment and be a fair system. But over the years, it really has evolved to put much more emphasis on specialty services as opposed to primary care services. And we're now in a position that, the folks at the Primary Care Collaborative and those in our community really believe we've got to move off of this fee-for-service system so that we can provide better access, better care, and more equity in terms of our healthcare services.
We hear about patient-centered medical home and that the goal is always to deliver patient-centric care. But when we're talking about things like prevention and early efficient intervention, the fee-for-service model doesn't deliver, because the nature of the system is to wait till there's something. It's a reactive model.
True enough. A little bit of history on the patient-centered medical home. So the organization that I lead, the Primary Care Collaborative, was founded to change primary care delivery and payment. And the primary care physician specialties and employers came together just about over a dozen years ago and really agreed that the PCMH model could help change both delivery and payment. And I think we've made more strides on delivery than we have on payment. In that, I think this model has helped practices to be more focused on managing populations and more proactive, and has really underscored the importance of using technology to deliver better care, and also a focus on really managing chronic conditions. That said, we've come to believe that the model is underpowered because payment has not been reformed in the way that we had first envisioned. And so instead of a full-fledged team providing a whole comprehensive set of services, in many instances, we really have a teamlet, a physician and an MA, and we don't have the envisioned, full spectrum of a care team helping you to manage chronic conditions, behavioral health integration, connecting the patient to the community. And so we really believe that in order to get to that model of team-based, comprehensive primary care, we need to radically and revolutionarily reform primary care payment.
Hyperdrive.
Hyperdrive. There you go.
I mean, we've seen that with COVID. I mean, over the last year, this pandemic, with all the pay cuts, I mean, I keep reading about even doctors getting their wages just cut by 20%. One doctor, a cardiologist from Ohio, told me that his pay was effectively cut by 50% during the pandemic because of not having the elective procedures. So I feel like all the furloughing of staff and just all the practices shutting down, even hospitals shutting down. I feel like this pandemic has really kind of just put all the shortcomings of the fee-for-service system just kind of out there, all the disparities. Like, people can see it. Even if you didn't know it was there before, you can definitely see it now.
I think that's exactly right, Faisel. And those practices that were receiving a prospective payment, so payment in advance for delivering care that would keep patients well and restore them to health, were in a much better position than practices that were reliant on fee-for-service and face-to-face visits. So when COVID restrictions came in and the regulations or the advice from CDC and from the states was to stay at home, all of a sudden there was no volume for these practices and their revenue plummeted. And it was really an epic, an epic decline. They went off the cliff, if you will, which was very frightening. And what I will say is that primary care practices quickly pivoted to telehealth platforms and also got on the phone and called their patients and provided care, whether or not they were going to get compensated for that care. So, professionalism really kicked in. They took care of their patients in any way they could without knowing if they would in fact get compensated. And, most of them were able to get telehealth platforms up and running. Medicare started paying parity for telehealth visits, the same as they did for face-to-face visits, and that really helped a lot. But I think there's a lesson here that the payment system that is based on face-to-face visits, is not very flexible and is really problematic in a pandemic situation.